have Dr. Willis do his COVID-19 update, and then after that, I'd like to have Angela Nicholson give an update on the rental assistance program as well. Go ahead, Dr.
Good morning,
Willis.
Supervisors. Thank you, Matthew. Good morning, Supervisors. Good morning, community. Thank you, Raleigh Katz, for your comments. I'm going to provide an update on our status regarding COVID-19, starting with the numbers and then getting into some of our key strategies for this week. So this is our website. This is the homepage where anyone is invited to browse to see our data, COVID-19 at coronavirus.hhs.org. This is we're seeing over almost 12,000 cases, 117 active cases in the community. That number reflects the number of people who are presumed to be infectious. That number continues to decline as case rates decline. 179 deaths, over 400,000 tested, and now over 150,000 of our residents have been vaccinated with at least one dose. Next slide, please. This is our epidemic curve showing just from that surge in the winter, showing a progressive decline in cases. And you see on the far right there where we are, which has really been a plateauing of our case rates, where we've been flirting with that margin between 2 cases per 100,000 residents per day on average in the adjusted case rate, which is the margin between the yellow and the orange tier. Next slide, please. I'm going to get into our vaccine strategy, and then we'll talk more about the tier status. So this is our progress regarding vaccinations. We have 76% of our population of age 16 and above have been vaccinated with at least one dose. 51.6% have received 2 doses of the 2-dose regimen, or 1 dose of the Johnson & Johnson product. This represents one of the most highly vaccinated communities in the state. Next slide, please. And this just shows the comparison of how Marin County is doing with regards to the number of doses per 100,000 residents among medium and large counties across the state. Next, please. This is our vaccine progress by age group, and then on the right in the red numbers is the number of individuals estimated to be in those groups who remain unvaccinated. That's our future. That's the progress that we're seeking to achieve, is reaching that remaining unvaccinated group. Last week, as we discussed, we opened to all age groups who are eligible to be vaccinated, so age 16 and above. Had aggressive outreach into our schools, with our pediatricians to try and bring in our 16 to 18-year-olds. Now only 36% of those age 16 to 49 remain unvaccinated. 22% of those age 50 to 64 remain unvaccinated, and only 6% of those above age 65 are estimated to be unvaccinated in Marin County currently. Next slide, please. And this is our vaccination rates broken down by age group and race ethnicity. And this is an ongoing analysis just to ensure that we're keeping up with our vision and our goals to around vaccine equity, and to make sure that there are no communities that are left behind as we move quickly in our vaccine distribution plan. And it demonstrates so far that our goal to make sure that we're reaching all communities, we are being relatively successful with similar rates between racial and ethnic groups with regards to vaccination. Next, please. This is where we are with in the tier status. So Marin County, as you know, is in tier 3, orange. We had achieved 1 week's credit towards the yellow tier last week. This week, we're looking at our numbers. The governor will make an announcement at noon. But typically, when we look at our own Marin County numbers, we're looking at the same numbers as the state. And when we look at the numbers yesterday, which was really the determinant of whether or not we would move forward, we slipped across that line back into the orange tier numbers with a case rate of about 2.5 per 100,000 over that week that they are looking at the state. So it seems unlikely that we'll be moving into the yellow tier this week. Next slide, please. So why will we not move into the yellow tier yet? Our adjusted case counts week ending April 10th. Remember, the state looks at a 1-week interval that is from 14 days ago to 7 days ago. So the week that is being analyzed for today's decision is the week that ends April 10th. And when we look at those numbers, we see a case count of about 2.5 residents per 100,000 residents, 2.5 cases per 100,000 residents per day. We require 2 consecutive weeks beneath 2 cases. The previous week, the week ending April 3rd, we had 1.7 adjusted cases. So we had that 1 week of credit towards yellow tier, but we slid back a little bit. And we've been talking about that as being a risk all the way along. Right now, the rates are low enough. We have to have just less than 2 adjusted cases for us. That's between 8 and 10 total cases on average per day as a county. So it's very sensitive to small changes. We saw an uptake in cases related to spring break travel. But look back to that week where we saw an increase that brought us above 2. Many of those cases, we had a few days where we had 20 new cases. Just a couple of days with 20 new cases really brings us above that 2 level. The majority of those cases were related to people who had traveled over the spring break, had come back, had gotten tested, and their positive tests contributed to that. I won't call it a surge, but it was enough of an increase to raise us above the margin. So the case rates, the good news is the case rates for the week ending April 17th, which is what will be looked at next week in terms of the tier determination, do appear lower. We're seeing single digit cases, again, most days over the past week. But the earliest we would now move to the yellow tier would be May 4th. Next slide, please. And this is just a graphic representation looking at our epidemic curve of that little bump that I mentioned related primarily to people traveling. And we have recommended against, just to be clear, we have recommended against non-essential travel as one of the most important factors for us for reducing surges in cases. And here we see just the evidence there of enough of a bump to prevent us from moving forward yet. Next, please. So why are we still vulnerable to outbreaks? I think this is an important moment to sort of step back, recognizing that we had anticipated moving to the yellow tier. We will be not taking that step, partly based on the behaviors that our community engaged in. We do not want to be falsely reassured by the progress we've made in vaccinations. Yes, we are among the most highly vaccinated communities, but we remain vulnerable. Only 32.7% of our residents are immune through vaccination, despite the fact that 75% of those age 16 and above have had at least 1 dose. And the reason that for that difference is twofold. One is that 20% of our population is ineligible right now to be vaccinated because they're 15 years or younger. That's we have 20% of our population are kids in those age range. So we can't even touch that group with vaccine yet. The Pfizer has applied to the FDA for emergency use authorization to vaccinate children age 12 to 15. We're hoping that might come in early May, and we would move very quickly to try and vaccinate our kids. But that's part of the group, part of our population that we can't reach with vaccination yet. And then importantly, because this is a 2-dose regimen and the doses with the Moderna a month apart, Pfizer 3 weeks apart, and then it takes 2 weeks after that second dose to have full immunity, it takes 5 to 6 weeks after the first dose to really for us to have the full benefit, immunologic benefit of the vaccine. And so we're looking at rates now with only 50% of us have had both doses. You have to look 2 weeks before that to see that it's only about 40%. 2 weeks before that, 50% have had at least 2 doses. So we're really looking at, into 5 to 6 weeks into the future before that 75% that have had at least 1 dose will be immunologically protected. So currently 6 or 7 out of 10 Marin residents are susceptible. Fortunately, the best protected or most vaccinated groups are our older residents, our healthcare workers, our teachers and school staff. Those are the groups that we were first inviting into vaccinations, and they've accumulated that 6 weeks necessary to have full immunity. Next, please. So it's important, again, that we stay the course, to continue the COVID-19 prevention measures we've been using to flatten the curve all the way along, while we celebrate the progress we've made with vaccinations, covering our nose and face with a mask, staying at least 6 feet apart, avoiding crowds and poorly ventilated spaces, washing our hands, and also avoiding non-essential travel. Next, please. What can still go wrong? We're obviously making progress in the pandemic in most parts of the United States. In California, case rates do continue to decline. Most counties are in the orange tier now. But we still have plenty of room for outbreaks. We have mask fatigue and breakdown of non-pharmaceutical interventions. We've seen some of that just in Marin County in the past week or the past 2 weeks. Unvaccinated groups, as we move forward with the vaccine distribution campaign, unvaccinated groups can still sustain transmission. So we want to make sure that we're reaching every community. There's a question around waning immunity. So how long will the protection of the vaccine last? That's an unanswered question. We hope that the vaccine would provide lifelong protection. It's unlikely that that will be the case, but we don't know when that immunity would start to wane. Another obvious wild card is the emergence of more transmissible or less immunologically susceptible variants. We're seeing an increasing number of the B.1.1.7 variant, that's the UK variant, characterized by increased infectivity, about 50% more infectious. In Marin County, between 5 and 10% of our cases are among those strains. And if 6 or 7 out of 10 remain susceptible, there's a risk there that if we let down our guard, that strain could take advantage and cause another surge in cases. And then, as global citizens, we think globally, we act locally. That's one of Marin County's strengths. It's important to apply that philosophy to the COVID-19 pandemic. This is truly a global pandemic, and we are probably really thinking globally, in fact, probably among the most highly vaccinated communities in the world. We're not an island, and we will need to lift our eyes above our own county at some point to recognize that we're not going to put this pandemic behind us until everyone has access to protection. Next slide, please. So the good news is that we have vaccine appointments available now for anyone who wants to be vaccinated. So if anyone in our community, anyone who's listening who has been frustrated they haven't been able to get a vaccine or is now ready to be vaccinated, there's an appointment available for you today, tomorrow, the next day, the day after that, at a variety of sites in Marin County. So there should be no reason that people cannot get vaccinated. It's open to everyone age 16 and older. It's completely free. Anyone who lives or works in Marin County can come to get vaccinated. We have next day appointments. Go to getvaccinatedmarin.org to learn more about the schedule and how to register, or we can also help you with telephonically. Next slide, please. The other important asset as we distribute vaccines across the county is an increasing number of mobile options. And these are options now where actually people are able to just walk up to the site and be registered on site by some of our staff to get vaccinated. On Tuesdays, we're out in West Marin working with Coastal Health Alliance and Point Reyes Station. On Wednesdays, we'll be in Novato, North Marin Community Services. On Thursdays, in Marin City Health and Wellness. On Fridays, at Hamilton Field in Novato. And on Saturdays, at the Canal Alliance in San Rafael. And we're establishing these as sort of reliable weekly offerings to have that cadence. So as people who may be hesitant choose to get vaccinated, they know exactly where to go, removing any barrier, either for access and convenience. Next slide, please. And then if you're still having trouble, you can call this hotline, 833-641-1988. That's the number to call if you need any help with getting an appointment for vaccine. If you need help registering for the appointment because the online process, you may not have good internet access or are having trouble navigating the website to register for an appointment, go ahead and call. If you need help with language, please feel free. We have Spanish language translation, Vietnamese, other languages available through a translation service. And then also if you need help getting to the vaccination site, we know that not everyone is able to actually have access to a vehicle and travel to the site. And we have transportation services that can help move people to vaccination sites. Or if you're not able to actually move from your home, we can send people out to you. So please, please call that number if you need any form of help getting a vaccine appointment. Next slide, please. And on a good note, so this is our status with regards to schools. As you know, Marin County has been, maybe among the counties that has the highest rate of schools open to in-person learning all the way along. We are now 91% of our schools in Marin County are open full-time to classroom-based learning. Each day that passes, about 50,000 students in Marin County are in school in person. We have over 3,500,000 total accumulated student days, with a total of 12 cases, only 12 cases of in-school transmission. And still no cases of where a student has infected an adult or a teacher in that setting. And we are much better protected now because we have vaccinated so successfully all of the adults in our in our schools. And then past weekend, invited our 16 to 18-year-olds who are newly eligible to be vaccinated into mass vaccination operations at the Marin Center and at the ferry terminal. Next, please. So in summary, COVID-19 transmission continues to decline, albeit slowly. We remain vulnerable to outbreaks. Vaccination remains the highest priority. We have next day availability across the county. There are many unknowns regarding our pandemic path, and we will continue to adapt as our conditions change. Next slide, please. Thank you. That concludes my presentation.